You might think all fruits are healthy, but for seniors, some can be surprisingly dangerous. While fruits are packed with vitamins and antioxidants, certain ones pose hidden risks for older adults. High sugar content can spike blood sugar levels, acidity can cause digestive discomfort, and some fruits even interfere with common medications. Others may present choking hazards due to their texture or small size. If you or a loved one is over 60, it's crucial to know which fruits to avoid or consume in moderation to maintain optimal health. In this guide, we'll reveal 7 dangerous fruits seniors should never eat and why they can be harmful. Have you or a loved one experienced health issues from eating certain fruits? Let us know in the comments. Dangerous fruits for seniors. 1. Grapefruit. Grapefruit may seem like a nutritious and refreshing fruit, but for seniors, it can be surprisingly dangerous due to its powerful interaction with certain medications. This citrus fruit contains compounds called furanocoumarins, which interfere with enzymes in the liver and intestines responsible for breaking down drugs. As a result, medications can stay in the bloodstream longer than intended, leading to potentially toxic levels in the body. One of the most concerning interactions is with blood thinners like warfarin, which are commonly prescribed to seniors for preventing blood clots and strokes. When grapefruit disrupts the metabolism of these medications, it can increase the risk of excessive bleeding or internal hemorrhaging. Similarly, grapefruit affects statins, a widely used class of cholesterol-lowering drugs, by preventing the body from properly processing them. This can lead to dangerous side effects, including severe muscle pain, liver damage, and kidney failure. Beyond blood thinners and statins, grapefruit can also interfere with blood pressure medications, anti-anxiety drugs, antihistamines, and even some pain relievers. Since seniors often take multiple prescriptions, eating grapefruit or drinking grapefruit juice can unknowingly put them at risk of serious health complications. Even small amounts can cause issues, and the effects can last for up to 24 to 48 hours after consumption. To stay safe, seniors should always check medication labels for grapefruit warnings and consult their doctor or pharmacist before including this fruit in their diet. Fortunately, there are safer alternatives like oranges, apples, and berries, which provide similar health benefits without dangerous drug interactions. By staying informed and making smart dietary choices, seniors can avoid these risks and protect their health. 2. Bananas. Bananas are often praised for their rich nutrient content, but for seniors with kidney disease, they can be a dangerous choice due to their high potassium levels. While potassium is essential for nerve function, muscle contractions, and heart health, excessive amounts can be harmful, especially for those with chronic kidney disease or impaired kidney function. Healthy kidneys regulate potassium levels by filtering out excess amounts through urine. However, when kidney function declines, potassium builds up in the bloodstream, leading to hyperkalemia, a condition that can cause irregular heartbeats, muscle weakness, numbness, and even life-threatening heart failure. Since bananas are one of the most potassium-rich fruits, consuming them in large amounts can significantly increase the risk for seniors with kidney issues. A medium-sized banana contains around 422 milligrams of potassium, which can quickly add up for individuals on a low-potassium diet. Doctors often recommend limiting potassium intake to 2,000 to 3,000 milligrams per day for kidney disease patients, meaning just a couple of bananas can push them over the safe limit. Moreover, symptoms of high potassium levels often go unnoticed until they become severe, making dietary awareness crucial. For seniors with kidney disease, safer fruit alternatives include apples, berries, grapes, and pears, which provide essential vitamins and fiber without dangerously high potassium levels. If potassium intake needs to be restricted, consulting a doctor or renal dietitian can help create a balanced meal plan. Since kidney disease is more common among seniors, understanding the risks of high potassium foods like bananas is essential for maintaining heart health and preventing dangerous complications. Always check with a healthcare provider before making dietary changes, and consider potassium-friendly alternatives to protect kidney function and overall well-being. 3. Cherries. Cherries are a delicious and antioxidant-rich fruit, but for seniors, especially those with diabetes or prediabetes, they can pose serious health risks due to their high natural sugar content. While cherries offer vitamins, fiber, and anti-inflammatory properties, their sugar levels can lead to rapid blood sugar spikes, increasing the risk of hyperglycemia and long-term complications like heart disease, nerve damage, and kidney issues. A 1-cup serving of cherries contains around 18 grams of sugar, which is significantly high for individuals managing blood sugar levels. Unlike fruits with a lower glycemic impact, cherries have a moderate glycemic index of around 62, meaning they can cause a quick rise in blood glucose levels. This is particularly concerning for seniors with insulin resistance, as their bodies struggle to process sugar efficiently. Another issue with cherries is their small size and addictive sweetness, making it easy to overconsume them without realizing it. Many people snack on cherries in large quantities, unknowingly exceeding their recommended sugar intake. Even dried cherries, commonly found in trail mixes and desserts, contain concentrated sugars, making them even more harmful for blood sugar control. For seniors with diabetes or metabolic disorders, safer fruit alternatives include berries, apples, and pears, which provide fiber and essential nutrients without causing extreme sugar spikes. If cherries are consumed, they should be eaten in moderation, paired with protein or healthy fats, and preferably fresh rather than dried or canned in syrup. Before making dietary choices, seniors with diabetes, prediabetes, or blood sugar concerns should consult a doctor or dietitian to ensure they are selecting the right fruits for their health needs. Managing sugar intake is key to preventing complications and maintaining overall well-being. 4. Dried fruits. Dried fruits like raisins, dates, and figs may seem like a healthy snack, but for seniors, especially those with diabetes or prediabetes, they can be surprisingly dangerous due to their high concentration of natural sugars. Unlike fresh fruit, which contains water that helps balance sugar content, dried fruits have had most of their moisture removed, making their sugar content far more concentrated per serving. This can lead to rapid blood sugar spikes, increasing the risk of hyperglycemia, insulin resistance, and diabetes complications. For example, a single cup of raisins contains about 98 grams of sugar, while just 2 medjool dates pack around 36 grams of sugar, more than a can of soda. Even figs, which are rich in fiber and nutrients, contain 48 grams of sugar per cup. Since seniors are more prone to blood sugar imbalances, heart disease, and metabolic disorders, consuming dried fruits in excess can put them at serious health risk. The glycemic index of dried fruits is also high, meaning they cause a quick rise in blood glucose levels. Raisins, for example, have a GI of 66, while dates range from 42 to 55, depending on the variety. This makes them unsuitable for seniors who need to maintain stable blood sugar levels. For those looking for healthier alternatives, fresh fruits like berries, apples, and pears are much better choices, as they provide fiber and nutrients without excessive sugar. If dried fruits are consumed, they should be eaten in very small portions, paired with protein or healthy fats to slow sugar absorption. Seniors managing diabetes, insulin resistance, or weight concerns should be cautious with dried fruits. Consulting a doctor or dietitian can help make better dietary choices to prevent complications and maintain overall health. 5. Pineapple. Pineapple is a tropical fruit known for its sweet and tangy flavor, but for seniors, it can pose digestive risks due to its high acidity and the presence of bromelain, a powerful enzyme that breaks down proteins. While pineapples are packed with vitamin C, antioxidants, and anti-inflammatory properties, their acidic nature can lead to acid reflux, heartburn, and stomach irritation, particularly for seniors with gastroesophageal reflux disease, ulcers, or sensitive digestive systems. The pH level of pineapple ranges from 3.2 to 4.0, making it one of the most acidic fruits. When consumed in excess, it can trigger acid reflux symptoms, causing discomfort, burning sensations, and bloating. Seniors who already experience indigestion or gastritis may find that eating pineapple worsens their symptoms. Additionally, bromelain, while beneficial in moderation, can cause stomach upset, diarrhea, or nausea if consumed in large amounts. Another concern is that pineapple's acidity can erode tooth enamel, increasing the risk of tooth sensitivity and decay, which is a common issue among seniors. Those with dentures, weak enamel, or gum problems should be particularly cautious when eating acidic fruits like pineapple. For seniors prone to acid reflux or digestive discomfort, it's best to consume pineapple in small portions, or opt for low-acid fruit alternatives such as bananas, melons, or pears, which are gentler on the stomach. Cooking pineapple or pairing it with alkaline foods like yogurt can also help neutralize some of its acidity. Seniors with acid reflux, ulcers, or digestive sensitivities should consult a doctor or dietitian before regularly consuming pineapple. Being mindful of acidic foods can help prevent discomfort and promote better digestive health as they age. 6. Unripe papaya. Unripe papaya is often used in salads, smoothies, and traditional remedies, but for seniors, it can pose serious health risks due to its high latex content. Green, unripe papaya contains papain, a natural enzyme found in latex that can cause allergic reactions, digestive issues, and complications for individuals with certain health conditions. One of the biggest concerns is that latex in unripe papaya can trigger allergic reactions, especially in people who are sensitive to latex or have latex allergies. Symptoms may include skin rashes, itching, swelling, difficulty breathing, and even anaphylaxis in severe cases. Seniors who have a history of food allergies, asthma, or latex sensitivity should avoid unripe papaya to prevent dangerous reactions. Another issue is that papain can be harsh on the digestive system, leading to stomach cramps, nausea, bloating, and diarrhea. This is particularly concerning for seniors with sensitive stomachs, irritable bowel syndrome (IBS), or acid reflux. Additionally, papain can act as a blood thinner, which may increase the risk of excessive bleeding for seniors taking anticoagulants like warfarin or aspirin. Pregnant women are also advised to avoid unripe papaya, as its high latex content may trigger uterine contractions and pose a risk for preterm labor or complications. While this may not directly affect most seniors, it is important for elderly caregivers or family members to be aware of these risks for younger relatives. For seniors looking for safer fruit alternatives, ripe papaya is a much better option, as it contains lower levels of latex and is easier to digest. Other non-allergenic fruits like apples, pears, and bananas can provide essential nutrients without the risk of allergic reactions. Always consult a doctor or dietitian before making dietary changes, especially if there are known allergies or underlying health conditions. 7. Pomegranates. Pomegranates are widely known for their antioxidant-rich seeds and heart health benefits, but for seniors taking blood pressure medications, they can pose serious health risks. This fruit contains natural compounds that can interfere with blood pressure-lowering drugs, potentially leading to dangerous drops in blood pressure or unintended side effects. One of the biggest concerns is that pomegranate juice acts similarly to grapefruit juice, affecting the way the body metabolizes medications. Certain compounds in pomegranates can inhibit liver enzymes responsible for breaking down drugs. As a result, blood pressure medications like ACE inhibitors, beta blockers, and calcium channel blockers can accumulate in the bloodstream, leading to low blood pressure, hypotension, dizziness, fainting, or even heart complications. Additionally, pomegranates have natural blood pressure-lowering properties which, when combined with medication, can cause excessive drops in blood pressure. This can increase the risk of falls, confusion, and reduced oxygen supply to the brain, which is particularly dangerous for seniors. Beyond medication interactions, pomegranates can also be problematic for individuals with kidney disease, as they contain moderate potassium levels. Seniors with chronic kidney disease, CKD, must monitor their potassium intake to avoid hyperkalemia, a condition that can lead to irregular heartbeats and muscle weakness. For seniors taking blood pressure medication, it's important to consult a doctor or pharmacist before consuming pomegranate or pomegranate juice. If included in the diet, it should be moderated and not consumed alongside medication. Safer fruit alternatives include apples, berries, and pears, which offer similar health benefits without the risk of interfering with blood pressure control. Managing dietary choices carefully can help seniors maintain their health while avoiding potentially dangerous complications. What seniors should eat instead: healthy alternatives. For seniors looking to maintain stable blood sugar levels, heart health, and digestion, Choosing the right fruits is essential. While some fruits can be risky due to high sugar, acidity, or medication interactions, several nutrient-dense alternatives provide essential vitamins, fiber, and antioxidants without negative side effects. Seniors managing diabetes, weight control, or metabolic disorders should opt for low glycemic fruits that won't cause blood sugar spikes. Berries, strawberries, blueberries, raspberries, blackberries, these are packed with antioxidants, fiber, and vitamin C, helping to support brain health, reduce inflammation, and regulate blood sugar levels. With a low glycemic index of around 25-40, they are ideal for seniors with diabetes or heart concerns. Apples. Rich in fiber and polyphenols, apples help improve digestion, lower cholesterol, and support heart health. Their fiber content slows sugar absorption, making them a better choice than high-sugar tropical fruits. Avocados. Unlike other fruits, avocados are low in sugar and high in healthy monounsaturated fats, which help reduce bad cholesterol and support brain function. They also provide potassium and fiber, making them beneficial for heart health and digestion. Fiber-rich fruits. Pears and guavas. Fiber is essential for digestive health, weight management, and preventing constipation, which is common among seniors. Pears. A medium-sized pear contains around 6 grams of fiber, making it one of the best fruits for digestion. Pears support gut health and blood sugar control while providing important vitamins. Guavas. This tropical fruit is a fiber powerhouse, offering more fiber per serving than most fruits. It's also rich in vitamin C, supports immunity, and helps regulate blood pressure. By choosing these low-sugar, fiber-rich fruits, seniors can enjoy delicious, nutrient-packed options without the health risks associated with high sugar or acidic fruits. Eating a balanced diet is essential for seniors to maintain optimal health, prevent chronic diseases, and avoid complications from certain fruits. While fruits are packed with vitamins, minerals, and antioxidants, not all are safe for older adults, especially those with diabetes, kidney disease, acid reflux, or medication interactions. To make the best dietary choices, seniors should follow expert-recommended tips for safe and healthy fruit consumption. Expert tips for seniors. Practice moderation. Even healthy fruits should be eaten in controlled portions to avoid excessive sugar, acidity, or potassium intake. Limit high-sugar fruits and opt for low-glycemic alternatives like berries, apples, and pears. Consult a doctor or dietitian. Seniors taking medications for blood pressure, cholesterol, or blood thinning should always check for potential food-drug interactions before adding certain fruits to their diet. Grapefruit, pomegranates, and bananas can interfere with medications, leading to serious health risks. Prioritize a balanced diet. Fruits should be part of a well-rounded diet that includes lean proteins, whole grains, healthy fats, and fiber-rich vegetables to support digestion, heart health, and blood sugar stability. Choose safer alternatives. Instead of risky fruits like pineapple, cherries, or dried fruits, seniors can enjoy low-sugar, fiber-rich options like avocados, guavas, and pears to maintain stable blood sugar and digestive health. By making smart dietary choices, seniors can enjoy the benefits of fruit without compromising their health. Being mindful of sugar content, acidity, and medication interactions can help prevent unwanted complications. For more senior health tips and expert nutrition advice, be sure to subscribe and stay informed. Your health is in your hands. Make every meal count.